And good afternoon, everyone. Thanks for joining us for this, our final press briefing of the week. Today, Orange County Mayor Jerry O. Demings will discuss our COVID-19 numbers, antigen testing in Orange County, a word on the flu. The mayor will also give an update on CARES funding for individuals and families and report on the work of our strike teams, eviction diversion, and more. From the Florida Department of Health here in Orange County, Dr. Raul Pino is here with important data on COVID-19 trending in our area and a look at hospitalizations. We begin with Mayor Demings. Mayor?
Thank you, Dr. Williamson. Thank you all for being here this afternoon. As we approach the end of another week, we have a lot to report on this week. We have reached several milestones. This is the 86th press conference that we have done since we started updating our public on the coronavirus here within our community. I want to also talk today a little bit about the promise of vaccines yet to come, but let me just share with you a little bit about what we're doing proactively here in Orange County to prepare for the eventuality that a vaccine will be available. The FDA certainly has already approved various trials that are underway. We have different healthcare organizations here within our community who are participating in some of those trials. We are awaiting guidance from the state as to how the vaccines will be distributed. But in anticipation of that, we have been meeting regularly with our healthcare partners, such as Dr. Pino and the Orange County Health Department, plus local hospitals and other healthcare partners. We have purchased a refrigerator, freezer, and an ultra-cold freezer to store approximately 150,000 doses of the vaccine. We have a photograph behind me that you can see what these refrigeration pieces of equipment will look like. We paid $67,000 for the 3 units that you see there. Obviously, the vaccine has to be kept cold at some pretty cold temperatures, and when it comes to time to give the vaccines out, our health services wanted to be prepared, and we want to serve as a model, really, for how to go about doing that by working with different partnerships within the community. Our public safety director, Danny Banks, is here somewhere in the room. There he is over there. And if you have any specific questions about that during the press event, we'll ask him to come up and share additional information with you. I said at the beginning of the week that we would likely surpass the 50,000 positive cases within Orange County this week, and we have. We now have 50,135 cases reported in Orange County year to date. That is an increase of 375 from yesterday. Sadly, I report again that 600 Orange County residents have died as a result of the coronavirus, and that is an increase of 9 since Monday. Again, our prayers go out to those families who have endured the loss of a loved one as a result of the novel coronavirus. Our 2-week positivity rate is inching up. It is now at 7.1%. Dr. Pino will have more details about the numbers that I just shared with you. There's some good news that I will share with you. We have increased the level of testing here within Orange County because of the rapid antigen test that we have made available at Barnett Park. It is proving to be a very popular thing for our residents. Orange County Health Services is also offering molecular or PCR tests at that site. Yesterday, we administered 1,268 different tests, and we have the capability to offer as many as 4,000 tests to Orange County residents within a week. And so we're off to a good start. This was the first week that we offered the antigen testing at Barnett Park. The team will remain at Barnett Park Monday through Friday from 9 a.m. to 5 p.m. until the end of the year. All ages are welcome, and it is a drive-through testing facility. For more information, please go to ocfl.net/testing, and you can click on number 1, and the testing map will come up with how to get to the Barnett Park location. Remember, however, that no appointments are necessary. You can actually just drive up without an appointment. As we approach the holiday season, I believe that a number of our residents really want to know whether they're positive or not. And so as a suggestion to those who will be gathering with family members, if you're going to have family who live in the area and you're going to come together, or family coming from outside the area, encourage your family members to get tested. At least that way you know when you congregate with your families what your status is. And so it may help everyone if someone needs to be isolated from the rest of the family to preclude the family from having the virus spread amongst itself. I want to commend the Florida Department of Health in Orange County and our Orange County Health Services for all of the recent successful flu events that have been underway here within the community. In total, 2,251 residents have gotten flu shots through the events that our Orange County Health Services and the Health Department have sponsored. Dr. Pino will likely share additional information about an event coming up this coming Saturday. Just as a reminder, our Cares for Residents program will reopen its portal on this coming Monday, November the 16th at 8 a.m. Of course, this is a program whereby our residents can make application for $1,000 if they have been impacted by the coronavirus. In order to serve more residents, the CARES team has changed an eligibility requirement to now allow multiple applications per household. Before, only one person per household could receive the funding. Now, if there is a roommate, a family member impacted by COVID, they can apply, even if someone else in the household already received a CARES grant. We do have Ms. Diane Arnold, who's here if you have any specific questions about that. However, you are still not eligible to apply if you have already been approved for CARES Act funding. So if you yourself have been approved, you can't reapply at this point, but others in your household who can show an impact are eligible to apply. We have, at this point, the last update I had, we're just under about $7.9 million in funding that has been sent to the Comptroller's Office for payment. Again, we will open the portal on Monday, coming at 8 a.m. You can get additional information by going to our website, ocfl.net/orangecares. We said that so many times now at these press events, I know everybody knows it by heart, right? Okay. Eviction diversion, let me just share a little bit of information about that program. We have, to date, paid out some $5 million for eviction diversion. This is where landlords and tenants agree to make application together to keep a family in their home. They can get up to $4,000 per household. We have $10 million remaining. We have until December the 30th of this year to expend the dollars that we have programmed and allocated. So there's still an opportunity for families who are in need to be able to apply to get the assistance that they are looking for. If you watch our briefings, you know that we are working hard with our partners to get our residents back on their feet and back into the job market as quickly as possible. We are partnering with Career Source of Central Florida and Valencia to offer a variety of short-term training courses at the Orange County Convention Center starting November 30th. We have programmed about $7 million in assistance through Career Source of Central Florida. But Orange County residents can apply for tuition assistance through Career Source of Central Florida's program called Help is Here, the Help is Here program. We have allocated some $2 million for that. And some of the courses being offered include carpentry, masonry, commercial truck driving, IT or network support specialist, and medical office specialist. I'm told that we have vacancies, job opportunities, in other words, in our community for those respective fields. And so if you find yourself unemployed and you want to upskill, learn a new skill, we encourage you to make applications for these programs and go through these short-term training programs. To qualify, you must be at least 18 years old, a resident of Orange County, and able to verify that you lost your job or suffered reduced wages because of the COVID-19 pandemic. For more information, you can go to CareerSourceCentralFlorida.com. Helps here. CareerSourceCentralFlorida.com. Help is here. Our strike teams continue to function within our community. We continue to get each day a fair number of complaints about certain types of businesses that are non-compliant. Our teams, I have to say, they've rolled up their sleeves and they've visited some 4,800 different county businesses over time. We still see a relatively high rate of compliance, about 81%. And lastly, we are a caring county, and we try hard to create programs to help everyone, but especially those who are in need and the downtrodden. I want to talk about a program. The first annual Hope-a-thon will be broadcast on Orange TV and feature 24 hours of inspiring stories from people who are recovering addicts. Individuals and families will share stories of hope and redemption. Funds raised by the Hope-a-thon will benefit local charities that support recovery. Those charities include One Heart for Women and Children and the Zebra Coalition. You can go to the website at thehopeathon.com for more information. And with that, I'm going to turn it over to Dr. Pino at this time.
Thank you, Mayor. Before we go into COVID-19, as the Mayor mentioned, our next flu event is going to be this Saturday, starting at 9 o'clock. We have sufficient vaccines to vaccinate approximately 1,200 individuals. So Colonial Promenade Mall at 9 o'clock this Saturday, first come, first serve, no insurance needed, no payments needed. It's just get in your car, roll off your sleeve, should go. We also have the choice for people who needs to walk into the place and also for those who may have accessibility issues. Again, our lines start at 9 o'clock. It will run until 3 p.m. We may be closing the lines by 2 o'clock, depending on volume. With that, with COVID-19, the mayor mentioned that we have to achieve or get to two sad numbers, over 50,000 infections in our county and over 600 people who have died. And I say over 6 because 9 deaths continue to be on review at the state level. So at least that number will go up by 9. Our recovery rate is 93%, and the age of the individual who has sadly died are from 46 to 87, 4 female, 5 male, 1 Hispanic, 6 non-Hispanics, 2 of unknown ethnicity, 2 Asian, 2 Black, 1 other, and 4 white. 6 of the individuals had pre-existing conditions. 3 we don't know if they had. I also brought some data that I would like to discuss with you to give you some illustration. There has been a lot of question about hospitalization, ICUs. People, have seen what's happening in other areas of the country. So we want to give you some information where we stand. So this is our hospital bed census. We are doing this now weekly. So the last week that we have full data is up to the 7th of November, right here. And if you can see, we still have over 1,000 beds available every day in our county. which is a good inventory for beds. With regard to ICU and census availability for COVID-19, in orange, right here you have the number of ICU beds that are available, and in gray you have the number of ICU beds in use for COVID-19, and in blue the total census of ICU. So as you have seen, our ICU use has declined, and last week on the 7th, we have 29 people on ICU bed for COVID-19 in our county. And these are county residents. It could be also that non-residents are using our systems. Here is COVID-19 ICU versus non-ICU, because sometimes when we give the reports every day to the mayor, we don't make a differentiation. We just say total number of ICU beds in use. And you can see it's a high proportion of use for other reasons besides COVID-19, and that was the 7th. And this is ventilators. Ventilators in use as well as ventilators on site. And as you can see over here, only 26 individuals were on ventilators on the 7th for COVID-19 diagnosis. And we have about over 600 ventilators in the county at that time. And today, the number continued to be over 600. And this is hospital census for COVID-19 in ICU, and it just gives you a clean picture of how the ICU bed for COVID-19 use has come down and where we are as the 7th with the 29 cases. This is COVID-19 non-ICU use, and you can see the numbers there as well for the 7th of 12. This is our countrywide hospital census for COVID-19 cases. So on the 7th of November, there were in our county 141 residents hospitalized for COVID-19 across all systems. And this is the percentage of by age. In blue, the COVID cases. In orange, the percentage of deaths of those age range represent in the total number of deaths. You know, we have talked about this in the past, but it's clearly illustrated here. First, our high numbers between 15 and 35 years old, and also our high percentage of death in the older population and lower in the younger population. And that's why we insist so much on preventing transmission from this group into this group to avoid a high number of deaths. This is the incidence rate for COVID-19 in cases 5 years of age to 70 years of age. And as you can see, it has increased in the last few weeks, slowly, but it has increased. This is for school-age children all over the pandemic since September 15. And in green, you will have the daily number of cases. In red, the curve. And this linear curve indicates, histogram, indicates to you the slow increased progression of the infection among children of a school age. This is the distribution of race just for death. And the interesting piece here that we always show is the health disparity right here among Afro-Americans and many other groups. For example, Afro-Americans are 23% of the population of the county. They are 16% of all cases for COVID-19, but they represent 28% of all death. So that is a disproportion right there. And we have talked before about health disparities and chronic disease management in minorities in our county and in the nation in general. And this is our curve for incidence rate per 100,000 per week of the infection. These are the weeks, these are the rates, and you can see from here how we continue to decrease over week 35, and then start to progressively increase very slowly, but increasing progressively. This is our epi curve. It shows the same that we show for 5 to 17 years old with a progression. This is our epi curve, and here the number of cases per week, and the decrease that we have seen last week for the first time, a decrease of 10%, a negative growth, I should say. How we compare to the state. In the state in general, 6.9 of all cases end up in hospitalizations. For us, it's a little bit lower, around 5.6. Healthcare workers, 8.7 of all infection. At the state is 9.4. Case fatality rate for us is about half of what it is for the state in total. And the median age for us is a lot lower than it is for the state. At 33, the state is 39. This is our positivity rate, rolling average, 14 days. And the mayor explained to you before how this has continued to increase progressively, very slowly, but continue to increase. Our positivity rate weekly, which has slowly increased. This is the PCR number of tests in our county. The mayor also explained to you and mentioned how we have increased the number of testing in our county. And these are long-term care facilities. Here, what we see in blue is the percentage of the number of residents with COVID-19 in long-term care facilities versus the number of employees of those same facilities with COVID-19 diagnosis. And this is interesting, and this indicates the work that the state of Florida really has done with long-term care facilities. So a few things here to look at it. First, both groups have decreased. It has decreased infection for residents and workers. Second, even in cases of elevated number of workers with infection, transmission to residents has not been as greater as the number of employees with infection. So there are steps and measures that are working. And remember, there was a time where the state and now the facilities are testing employees and residents every 2 weeks. So that really yields great results. And this is the percentage of residents with COVID-19 infections in long-term care facilities. And this is something that we really look very closely because of this. Because it mimics, even that the percentage of the population is a lot higher, the curve for fatalities, it mimics the curve for fatalities in the county as a total. But the number are a lot lower, and we want to keep it that way. We don't want to go here where we're having those high numbers of fatalities in our long-term facilities. I hope that I didn't get you dizzy with this data. I walked fast through it, but I will answer any questions that you may have.
All right, Dr. Pino, that was pretty thorough. At this point, we will open it up to questions. Remember, if there's any Spanish-speaking media present, we have the ability to translate here for your questions. And so we'll start there at the back of the room today.
Hello, Troy Campbell with Channel 6. My question's for Dr. Pino. On Saturday, 250,000 people are expected to head over to the coast to watch some astronauts shoot up into space. What is your recommendation for people here? Should they stay at home, watch it on TV? Do you suggest they go out there?
Well, all depends on how it's done. Not everyone goes to the same location to watch the launches. There are several locations that people go. They normally stay in their vehicles for the most part. So with that will be safer than congregating in a large group in small rooms. And we advise people to follow all the guidelines from the CDC. And if you don't have to go, don't go. You can even watch it from Orlando. It doesn't feel the same way. I have done both. but it's quite safe to do it if you follow the CDC guidelines.
Hi, I'm Chris Guardaro from Washington News. My question is also for Dr. Pino. When we looked at the hospital bed availability chart, it looked like the total number of available beds fluctuated a little bit. Is that because the hospitals are able to increase beds? And is there a timeline on when they might increase the beds and by how much?
So that's an interesting question. Hospital beds fluctuates because at the same time that you have the bed, you have to have the staffing that the bed requires. Not only you have the bed and the space, but you have to have the staffing. So hospitals have an approved maximum number of beds based on the staffing that they have, but they can have surge capacity. So in some cases, other units can be converted, other spaces can be adequately fitted for clinical treatment, even when they may not be normally used as such. But again, you have to have the staffing. And whatever that proportion is, maybe 1.5 nurses per bed, this type of staffing, this number of doctors. So not only increasing beds, physically increasing the bed, but also the rotation of the staff plays a role in that.
Eric Mock, Spectrum News 13. Sorry, Mayor, another question from Dr. Pino. You showed us the chart on the school-age children and the COVID-19 cases in school-age children, and kind of that we saw overall there's been an increase since September. What is your, I guess, impression from that data about any spread or anything that's going on, with school-age children? And it's still up in the air whether or not all kids are going to have to go back to on campus. It's not really up to the district, it's up to the state. What do you think should be done in that scenario as far as from a health perspective, next year?
Oh, that part I'm not going to touch it. The part of the scenario, what should be done? No, the board is here, I believe. I don't know what type of guidelines they have received on that regard. I will not be receiving those guidelines. But with regard to the infections are not happening in the school per se, although the number of cases we follow school children. Before school started, remember I showed you a baseline of that data because we wanted to follow that data and track it. What is happening is really the infections are being acquired by group of friends in the school systems outside the schools. So what we have seen a lot happening is that a group of friends who go together to a school, go to an activity outside of the school, and that's where they acquire the infection. Now, I'm not saying that transmission may have not happened in the schools or yes or no. I'm pretty sure it may have happened, but in those cases, we have been with the school help so aggressive in quarantine and isolation that those transmissions are not happening in the school at large scale. Again, what we have seen is friends and family acquiring the disease outside of the school.
This next question was texted in from Lauren Seabrook with WFTV for you, Dr. Pino. The question reads, we're getting closer to people being able to take the COVID vaccine, and we also have Advent Health asking for volunteers to take vaccines in the trial phase. Why should people feel safe getting this vaccine in the trial phase or after it's approved for mass distribution?
So, that's a very, very good question. And that's an individual decision. Now, when you go into a clinical trial, phase 3, I'm assuming you are talking about phase 3 with humans, people have to go through a consent process. And in that consent process, they will be explained what the expectations are, which side effects that they may face from the treatment or the vaccine or whatever is being in the trial. And then the individual have to make a decision if they want to participate. There is not much data out there with regard to safety yet, because that's the data that has been collected through the human clinical trials. So that's an individual decision.
Thank you. And this final question is to just about everybody in the room here from Ryan Lynch in the Orlando Business Journal. It reads, what kind of planning is going into the distribution? He's referring to the vaccine. How might that look is it more fleshed out than when he last asked? Reference to the coolers being here, the refrigerators being here, we have the pieces in place.
Director Banks, come on up.
Thank you. So we've been doing a lot of planning and working for several months now, anticipating at a point in time we will get access to the vaccine. We don't know what that's going to look like yet, but in response to his question, we have pre-planned and pre-purchased and have in our possession now, you saw the pictures, the freezers that we anticipate will be necessary to store the vaccine. We've already got a plan in place that should we get access to the vaccine, to start a network of distribution sites that we will make accessible certainly to the public. One thing I want to caution everybody on is, even if we get hundreds of thousands of doses at one time, it's certainly going to take some time before we will be able to offer those doses and vaccinate our entire population, even at a rate of, say, even 10,000 vaccinations per day. It's going to take some time to administer those vaccinations to our entire population. But importantly, we're going to implement a program to ensure that we present that opportunity to our citizens. I know Dr. Pino certainly is working with us and planning from the Department of Health that same opportunity as well. And what will be important is we have a plan in place once we get access to these vaccines to strategically move them out into the community so that everybody can have access. That may look like certain subsets of our population, and that may be our healthcare officials, first responders, those perhaps even those in assisted living facilities who are more at-risk groups. Perhaps those might be the first to get the vaccination, but importantly, we will have a plan in place and already working on that now, working with our healthcare partners to implement that once we get access to the vaccine.
Thank you.
Okay, if there are no other questions, I want to give a shout out to the Orange County Children's Safety Village. I'm wearing their facial covering today. And also, just as a reminder, when we open up the portal on Monday, it will open at 8 a.m., but it will close at noon. So we want you to prepare in advance. Is that okay?
The small business grant program.
Okay, the small business grant program is closing at noon, right?
Yes,
all right. Small business grant program is closing at noon. All right, so with that, if there are no other questions, thank you all for joining us today, and we hope you have a safe weekend as well.